You're listening to the 88.1 myFM Radiothon for local healthcare. I'm Brian Turner, and today I'm with Lianne Learmonth, Vice President, Chief Nursing Executive for both the Carleton Place and District Memorial Hospital and the Learmonth Hospital as well. How are you doing today?
Fantastic. It's great to be here.
So let's start off with exactly what you do for the facilities we're representing today.
Right. Basically, I'm responsible for most things clinical at both hospitals. The nurses report to me in the end, and I look after all the clinical operations that need to go on every day. Staffing, patient care, policies, and I'm also even a member of the board of directors.
And a lot of changes underway right at this facility we're at today, the Carleton Place and District Memorial Hospital, brand new emergency center getting ready to open. That's got to be an exciting time.
It's been a long journey for the team here for sure, but we are very excited to be able to get into our new building and improve really the quality of care that we're giving to patients who come through our doors.
And that brings in the question, how the equipment that the community funds will help make possible. What does that mean to the hospital and the community at large?
Not everyone knows that our equipment is not funded by our provincial government, that the communities are responsible for raising funds to support the equipment that we need. The new emergency department, we are bringing some equipment from the old department, but we're almost tripling our space, so we need to supply the equipment that goes into those rooms. This community has stepped up big time over the last 4 or 5 years to make sure when we move in, we have everything we need at our fingertips in order to provide that excellent care that we're known for.
So this need for equipment doesn't stop, though, just because you've got a new building, you have a new emergency department is going to be equipped with the latest in technology, but it doesn't end. It's continual.
It's an ongoing need to increase maybe the amount of equipment, but also the quality. And it's about a 10-year cycle for most things, sort of electronic or that need to have new technology in them. For example, vital signs machines. We're on the cusp of being able to integrate them into our electronic health record. So the nurse can scan the armband of the patient, take the vital signs, and push save. And it goes into the document, in that electronic document. The nurse doesn't need to write it on a piece of paper anymore. Real time.
So that means any healthcare practitioner involved in that patient's case will have instant live results at their fingertips.
100%. And, it's time saving. But in order to have that technology, we had to upgrade our units and provide more of them at the bedside.
If you had a wish that you could express to everyone listening today, what would that be for raising funds for this facility?
Donation dollars are at a premium for people, right? It's very hard to give to everybody in need, but think about your families and your loved ones and your neighbors and the community. What's the best thing in the end? And the best thing, I think, is healthcare. And if none of us are feeling well, we turn to the healthcare in our community to try and make us feel better. And we do that every single day. In Carleton Place this week, we broke all records for our emergency department. 73 people walked through our doors asking for help, and we provided that care. It was the largest day ever in our history.
And of course, one of the unique things about donating to a facility such as the hospital here in Carleton Place or Learmonth, it's something that you're going to be able to see for years and years and years. Every time you drive by, you'll feel that sense of, I helped, bring something to that new emergency department or new ward.
Yeah, I think people say my hospital, right? This is my community. We say I live here, and that's my hospital, and that's where I go when I need help.
I'm Brian Turner. The 88.1 myFM Radiothon for local healthcare continues.